have started talking about interstitial versus airspace pattern. So interstitial pattern is more fine, thin, lacy, linear compared to the alveolar, which is more fluffy, dense, and coalescing. So your job today is to be able to see the difference between this thin, linear, lacy pattern versus the fluffy, dense pattern over there. If you can walk out of here and tell the difference between these two, then your job's done. Yeah, and it's even better if you can hallucinate that air bronchogram. Then I'm very happy. So if we go down the path of interstitial pattern, the list is huge. It's enormous of what can cause fibrosis in the lungs. And we'll learn more about that next quarter. This one, it just said, the film jacket just says interstitial fibrosis, right? But it could be asbestosis, silicosis, sarcoidosis. I mean, there's a whole bunch of diseases, rheumatoid arthritis, ankylosing spondylitis, that may present with fibrosis in the lung. So clinically, a patient with this much fibrosis, because there's fibrosis here and there's also some on the other side, they're going to present with shortness of breath and decreased exercise tolerance. But they're not going to have a fever, or it's not acute because it's more like a chronic process, right? They'll have a history of inhaling asbestos fibers or something like that.
You said the patient with the alveolar pattern, they will have same shortness of breath.
Mm-hmm. Yeah. So this patient also has shortness of breath and decreased exercise tolerance, but it's more like an acute reaction in his case. Congestive heart failure is also going to show as an alveolar pattern, but then it's more like a chronic disease scenario where they have congestive heart failure and swelling of the ankles and pitting edema.
Dr. Rook, what was
Yeah.
the fluffy pattern again?
So this is alveolar airspace.
Okay.
So Dr. Fox makes a big deal out of the sizes of these nodules, right? So if the nodule is bigger than 5 millimeters, it's definitely alveolar airspace. If the nodule is between 3 and 5 millimeters, I believe he puts that in the interstitial nodular category. I don't remember, because I use a different millimeter. I don't go into such detail. But I'll show you something.